The Families First Signature Program by Save the Children is a program to promote a safe family environment for raising and caring for children, either in their own families or in family and community-based care alternatives. A family environment offers children the stability, consistency, and sustainability children need to develop. This is where children form attachments to their caregivers, learn safety, consistency, trust, and self-esteem. When we talk about permanency, we mean a permanent family gives a child a sense of belonging and love. Children need a parent figure and opportunities to experience and grow up together in family life. They need these parents to form secure attachments where they feel valued, protected, and cared for, and to be involved with daily life within the community and wider society. In 2014, Indonesia's total population is around 237 million people. That is a lot of families and even more children. Out of those, 84 million are children, with more than 50% of them are living with less than $2 per day. That means more than 40 million children are struggling to meet their basic needs. This statistic is made considerably worse by the reality that many of these children are living in orphanages, despite the fact that many of them are not orphans. While many people wanted to help these children, they didn't understand that supporting the family directly instead of institutions would help the children grow up in the most protective environment. Families First began at the end of 2005 with a rapid assessment of child care institutions in Aceh, which assessed the situation concerning the child victims of the Aceh tsunami that were placed in the institutions. The findings showed that most were placed there because their parents were struggling, not because they had no home or were orphans. This was followed in 2007 by the first ever national level research called Someone That Matters, which described the quality of care in child care institutions in Indonesia. Indonesia has one of the highest numbers of child care institutions in the world. It is estimated that 500,000 children spend the greater part of their childhoods in 8,000 child care institutions across Indonesia. Most majorities of these children, around 90%, still have one or both parents alive. The main reason these children are placed in institutional care by their families is because the families are too poor to send them to school. It does not mean they are too poor to care for their children. Many families were forced to decide between keeping the child that they love or having their child access education. This is a choice that no family should have to make. Placing children in childcare institutions is considered the only way to ensure that they get further education. As the result, families are torn apart as children are forced to stay in care until they graduate from senior high school and there is no review of their placement. The problem is that no child should be separated from their parents just to go to school. International research has proven that families, even poor families, provide much more love, security, and protection than even the best childcare institutions. Globally, the most protective environment for a child is the family. In addition, our research found that in many institutions, the quality of care and the quality of education is poor. Even though parents send their children to a child care institution to access education, once they are there, education is not guaranteed. Many children are neglected and in some cases are abused. For all children, long-term stay in institutions can have a lasting negative impact. Our researches became basis for Families First. Families First is the government of Indonesia and Save the Children's program to overcome the problem of children being unnecessarily separated from their families by shifting the paradigm from institutional-based care toward family-based care. Families First is the government of Indonesia and Save the Children's program to overcome the problem of children being unnecessarily separated from their families by shifting the paradigm from institutional-based care toward family-based care, and establishment of effective child protection system that will prevent institutionalization, strengthen the role of district and provincial governments, and provide response for children who are vulnerable and at risk to be institutionalized. To achieve this objective, the Families First Signature Program focuses on 3 components. Prevention and support. Families understand the importance of family care, are better able to take care for vulnerable children within their own homes, and can access services like education and support in their own communities. All of this work helps to empower children, families, communities, and local government to prevent unnecessary institutionalization. Direct response. Children facing problems in care and protection receive effective, appropriate professional support through accredited social workers who work together with their family to create a plan which meets their needs and best interests in a safe family environment. Legal reform. National, provincial, and district laws provide legal safeguards to children, preventing unnecessary institutionalization and promoting family-based care. So, what is being done in the Families First Signature Program? In the prevention component, the program is helping to give vulnerable families access to social protection programming, development of community-based child protection, and piloting a parenting program in several areas. The community-based child protection component helps to improve access to basic services like social protection and community mobilization to help create solutions to the hidden costs of education like transport and school uniforms. In West Java, the program started with the Ministry of Social Affairs and 26 childcare institutions in 5 districts to support children at home. Through this program, we supported 450 children in 2011, 601 children in 2012, and 1,350 children in 2014. In Yogyakarta, the program encouraged provincial government to set aside funds to support children at homes, with 360 children supported in 2013, 1,350 in 2014, and 1,500 children in 2015. The program also set up and is piloting a parenting program with community workers and an integrated early childhood and health program in East Nusa Tenggara in 2015. In the direct response component, the program facilitated the establishment of the new innovative program of Child and Family Support Service Model, or PDAK, Pusat Dukungan Anak dan Keluarga, in 2010 in Bandung. It is the first community-based non-residential model of intervention with professional social workers aimed at protection and care for children through support for families. The program, in partnership with local government, works with families to improve care and protection of their children through education, skills development, referral to services, and linkage with social assistance and counseling. The program also works hand-in-hand with local authorities and build partnership with childcare institutions so it can demonstrate how government social workers can support the development of a family-focused child protection system. There are 800 cases of children that have been managed in Bandung, Cianjur, Yogyakarta, NTT, and Lampung, By June 2015, many of these children can again enjoy living with families after reunification and family strengthening. Finally, in the legal reform component, the program solidifies all of these components with the legal support in the form of government laws and policies. This effort began in 2009 with the formulation of National Standards of Care for Childcare Institutions, or NSC, and was adopted by government in 2011. This was followed by the establishment of accreditation body in 2011. Pilot projects for the NSC were then conducted in Yogyakarta and Bandung from 2011. As of June 2015, the NSC has been rolled out to 1,216 child care institutions and 2,503 staff of institutions in 30 provinces, and the accreditation body has accredited 185 of these institutions. The program also helped advocating the formulation of norms, standards, procedures, and criteria of child care in 2013 that provided guidance for family support and alternative care mechanisms for national and local government. The program also has been helping to create national government regulations on care since 2014, including establishing guidelines of foster care. The program also helped improving social work education in Indonesia, starting with reforming the Association of Social Work Education in 2010. The program then helped establishing national social work curriculum in 2011 and the implementation of the social work education standards in schools of social work in 2013. The program also organized several trainings for lecturers, such as permanency planning, good parenting, child protection and child abuse, as well as human rights and children's rights. In the same time, the program also supported the Social Workers Association to reform the organization with clear registration and establishment of certifications and license systems, and collaborate with government, social work education associations, and the National Council of Social Welfare Organizations. The certification body was established in 2011 and started to conduct national examinations for social work certification. Like other professions in Indonesia, to be a social worker now, you need to pass an exam and meet minimum criteria. Before Families First, there was no concept of social work as a profession, and by June 2015, there are now 300 social workers that have been certified, but this is just the beginning. This competency and legal acknowledgement through certification and license system will strengthen social work practice such as those developed by PDAK, the Child and Family Support Service model. The effort to promote a safe family environment for children can only be undertaken together. Governments, multilateral organizations, donors, universities, NGOs, faith-based organizations, social work associations, organizations and institutions, as well as communities must all continue to take action to stop the harmful institutionalization of children. The design and delivery of national and local child care and protection systems must be transformed to enable families to look after their own children and to ensure that wherever necessary, children have access to positive family-based care alternatives. The most protective environment for children are safe, loving families. Helping children means helping families. This is why Families First works to help all actors, from children themselves to national government support family-based care.